So today we are here to do a health assessment video. We have our privacy. I did hand hygiene before the video and I put my gloves on. So to start, can you tell me your name?
Lance Kephart.
And your date of birth?
8/29/71.
Can you tell me what year it is?
2019.
And can you tell me the month?
It is October.
So you can tell that he's alert and oriented. He was able to answer all my questions. You can tell that his speech is clear. He told us his birthday, so he's 48 years old. When we did the math, you can tell he's a white male. He pretty much looks his age. So first we're gonna start with our head to toe assessment. So we're gonna start with his head, so you can see it's symmetric. He's gonna go ahead and smile for us. He's able to follow commands, and you can see the symmetry in his face and in his cheeks. So we're going to go ahead and start testing some nerves. So he smiled for us. He's going to stick his tongue out, say ah. He's going to good. He's going to shrug his shoulders and all that, and he can hear us and everything. He can move his facials. So next we're going to go ahead and look at his eyes, and we don't have an eye chart, but you can see that he does wear glasses, so we're going to go ahead and remove those. So first we're going to have him, I'm just going to look and see if his pupils react. And they both reacted the same. You can tell by looking at his eyes that there's no redness, there's no yellowing or no drainage coming from his eyes. We're also going to have him follow my finger. So if you look at this one and just follow my finger with both eyes. And don't move your head. Follow this finger.
Oh, you said to follow that way.
Stay here and then follow here.
Oh, okay.
So his head's staying in the spot, and you can see his eyes are going where they need to go. Good. Okay, so the next thing we're going to do is we're going to look in his nose. And then here on the left, it looks like he has a deviated symptom, so you can see that sticking out there, okay? Take a deep breath for me. And you can hear that his nose is clear. There's no stuffiness or anything in there. I'm going to let it out. I'm going to have you open your mouth again. Stick your tongue out. You can see there's no redness in his mouth or anything like that. And move your tongue side to side. And the other way. Good. So you can see all that's working too. Next, we're going to look in his ears. I don't have an otoscope, but we're looking on the outside. You can see that there's no redness or drainage, and when you feel it, there's no bumps or anything like that. And from what I can see, there's no redness. Check this side, do the same. There. So we're working our way down. So now we're going to go into his neck, and we're looking at his skin. Just a little bit of redness there. Other side looks good, but it does look symmetric, so when we feel for lymph nodes, not feel any bumps or anything like that. Down in here to feel. If you feel here, his trachea's midline is not deviated to side. So next we're going to go ahead and listen to his lungs. Don't feel anything on the chest or anything you have to worry about. So we listen on the front and the back, and we also listen on the side, so anterior, posteriorly. So we're going to start in the back. Go ahead and take a deep breath. And out. So I'm moving my weights to the front and start over here. Okay, and now I would this on the sides. also here, I'm also going to listen in his neck to see if there's any bruise or anything. And nothing right there. So while we're also here, we're going to go ahead and listen to his heart. And we listen in so many different spots so we can hear all the lung sounds. Or all the heart sounds, I mean. So his heart is regular. The rhythm's good. It's not too fast or too slow. It's going at a normal pace. So now we're going to move down into the abdomen. So just looking at it through his shirt, you can see that his stomach is symmetric and everything. We're going to listen first before we palpate. So bowel sounds are present in all four quadrants. We're going to do a light palpitation first to see, is there any pain?
Nope.
Okay, and go a little bit deeper. Any pain there? And no pain. Let's just tickle. Okay, so before we go to the lower half, we're going to check the upper half. So here we're going to check like skin color, make sure the hair is even and everywhere. We'll also do some range of motions while we're here too. So we just look, and there's no redness or anything. You can see he's able to move his arms back and forth and everything. He's doing it at the elbow and at the wrist. He's able to wiggle his fingers. No numbness or tingling or anything. We're going to check a larger range of motion. So I'm going to put your arms above your head and do a circle. Good. Full circle. That's good. So I'm going to go ahead. We'll just test some strength now. So I'm going to bend your arms like this and let me pull and then push. Good. I'm going to push your arms out to the side. We're going to test more. So I'm going to push down. And then, good. You can test all of that. So while we're down here, we're looking at his joints. You can see that nothing's really swollen, even down into his fingers. His fingernails, you can tell, are nice and pink. There's no clubbing, no rounding. They're nice and even. Everything's clean. We check cap refill and we squeeze, and it releases. It comes back within 3 seconds. So we'll check this hand. The same with this one. Joints look good. Fingers look good. Check the refill, and it comes right back. So now we are going to go ahead and check his legs. So the same here. His knees look the same. Looks like he does have a little bit of a notch right there. But everything else looks good. A little bit of a bruise there looking down into his legs. Check his legs for edema. Nothing's staying. Nothing's there, even down into the ankle or up here. We're going to check his pulses. We'll do that when we're up here. Same, and then we'll check his pulses and his feet. They feel equal and the same. Looking at his color, his feet are a little cold, so it's a little bit slower. See, coming in. We'll also look at his joints and his toes, and everything looks good there. Looking at his toenail color, everything's pink also, and looks good.